Scenario 2. In this training video, we will discuss and demonstrate how to properly care for an unconscious football player with a suspected C-spine injury. Upon initial evaluation, it is determined that the patient is breathing, has a pulse, and is prone. There are 5 rescuers available. When first responders arrive on scene, one pre-designated rescuer, who will be referred to as Rescuer 1 from here on out, will assess the patient's level of consciousness and check pulse and breathing status. Rescuer 1 will then stabilize the patient's cervical spine using either the forearm trap squeeze or the head hold method. Because this patient is prone with their head turned to the side, Rescuer 1 will need to adjust their hands to stabilize the C-spine in such a way that when the patient is rolled, Rescuer 1's hands automatically adjust position with the roll. Rescuer 1 will tell the rescuer with them to activate the emergency action plan using the predetermined signal of making an X with their arms over their head. Rescuer 1 has control of the situation and will give all commands, as they are the person stabilizing C-spine. Commands will be given by using specific rescuers' names, so it is clear who is to complete which task. Upon seeing the emergency signal, additional rescuers on the sideline will activate the emergency action plan, call 911, send someone to meet the ambulance, and arrive on scene with the emergency equipment. Rescuer 1 will communicate the patient's status with them and designate one rescuer to continuously monitor and record the patient's vitals throughout the rescue. At this time, the patient needs to be rolled over and placed onto the spine board. Because there are only 5 rescuers available, the patient is prone with their head turned. The best technique to do this is a log roll push. Rescuer 1 will instruct 3 rescuers to slide their hands under the patient and the patient's shoulder pads at the shoulder, torso, hip, and leg regions. Rescuer 1 will instruct the last available rescuer to command the spine board. Rescuer 1 will confirm that all rescuers are set. Then, on Rescuer 1's count, the 3 rescuers will push the patient onto their side while the last rescuer positions the spine board behind the patient at a 45-degree angle. On the count of Rescuer 1, the 3 rescuers will slowly lower the patient onto the board, and the last rescuer will use the board as a wedge to get the patient onto the board, then slowly lower it to the ground. Once the patient is on the spine board, Rescuer 1 will instruct another rescuer to cut the patient's jersey off using the T method. The rescuer will start at the top center of the jersey, cutting down and away from the patient's face, then across the sleeves from shoulder to shoulder. At this time, the rescuer will also cut the laces on the shoulder pads. Once the jersey has been removed, Rescuer 1 will then direct another rescuer, who will be referred to as Rescuer 2, to take control of C-spine anteriorly and posteriorly using a vice grip underneath the patient's shoulder pads. Rescuer 2 now has control of the situation and will give all commands. Once Rescuer 2 has assumed proper control of C-spine, they will instruct 2 additional rescuers to unstrap the sides of the shoulder pads. Rescuer 2 will then instruct Rescuer 1 to let go of their C-spine hold and remove the patient's helmet. Once the helmet is off, Rescuer 2 will instruct Rescuer 1 and an additional rescuer to remove the shoulder pads. Rescuer 2 will then instruct Rescuer 1 to regain control of the C-spine and take control of the situation and give all commands. Following equipment removal, Rescuer 1 will then instruct 2 rescuers to place the cervical collar on the patient. Rescuers will measure the C-collar by using the distance between the top of the patient's sternum and the tip of their chin. Again, the patient's status and vitals are continuing to be monitored and recorded by the designated rescuer throughout the whole process. Once the cervical collar is in place, rescuers will begin strapping the patient to the board at the torso, hips, thighs, and lower legs. Rescuers should use the X strap technique at the torso and hips. Rescuers should work together to put the straps in place and simultaneously tighten them. Rescuers will also strap or tape the patient's wrist and hands together at this time. Once the patient's body has been strapped down, the last thing to be stabilized to the board should be the patient's head. Rescuer 1 will instruct 2 rescuers to place blocks on both sides of the patient's head, one at a time, so Rescuer 1 can maintain cervical stabilization. Once the blocks are in place, forehead and chin straps will be placed around the blocks to further ensure the patient's head does not move. Again, vitals are continuing to be monitored throughout the whole process. The patient is now ready to be transported to the hospital via ambulance.